On this stat episode of the Regimen, Kratom is likely coming to Rhode Island. Will increase access help or harm? Hello, pharmacists and friends. Today is Friday, June 14th, 2024. Welcome to the Stat Regimen, featuring breaking public health news. My name's Liz Arnold. I'm a 6th and final year Doctor of Pharmacy student at the University of Rhode Island, working alongside Dr. Bratberg in the Rhode Island Department of Health.
And I'm Jeff Bratberg. I'm a clinical professor of pharmacy practice and clinical research at the URI College of Pharmacy and the Academic Collaborations Officer at the Rhode Island Department of Health. As a reminder to our listeners, the opinions expressed in this podcast do not represent the opinions of the United States government, the Rhode Island Department of Health, nor the University of Rhode Island. Liz, you, Chris Federico, other students, and I have been talking for months, it seems, about Kratom, which is also called Kratom, but we'll stick with Kratom here. There are some bills that are removing Kratom as a Schedule I substance from the Rhode Island Controlled Substance Act. So for those listeners who may not know, the Drug Enforcement Administration, or the DEA, classifies substances that have no medical use and a high potential for being misused as a Schedule I substance. So some other things in this are cannabis for now, psilocybin, which is a psychedelic, or MDMA or ecstasy. So again, we mention MDMA and cannabis purposely as there are data showing they do have potential medical uses and could be safe.
So what does the bill do?
So if these bills become law, and again, they have to be signed by the governor, they would do the following, and this isn't comprehensive. They would ban contamination of Kratom, or what's called adulteration with dangerous substances, doesn't list what those are, establishes an age threshold of 21 to buy and possess Kratom, like nicotine or cannabis or alcohol, prevent it from being a state Schedule I controlled substance. It actually bans Kratom that is in forms that mimics candy or is marketed to underage people. It establishes a state product registration system for processors, including annual lab testing for those dangerous substances, and sets up a system of fines so that processors and retailers who violate the rules have to pay fines if they aren't following the rules. It can't contain synthetic active ingredients or compounds derived from the Kratom plant, and it names the place of business of the processor, manufacturer, packer, or distributor. So it also says that Kratom has to be labeled. What are some of those unusual labeling requirements, Liz?
So the bills require certain labeling directions to ensure safe and effective use, including that it may be habit-forming. It's recommended to not be used by pregnant people. Statements are not approved by the Food and Drug Administration, or the FDA. The amount of Kratom plant product, not the active ingredient, per serving, and the number of servings safe to consume in 24 hours. So if and when this product's going to be available for purchase, we need to make sure that consumers have all the information available and are aware of the risks associated with Kratom.
Okay, so let's start with the basics. What is Kratom anyway?
So Kratom is a species of tree that's found in Southeast Asia natively. The leaves have been used by people there for centuries for different purposes. So the people there would chew fresh leaves, or they would make a liquid from the fresh leaves called a decoction and drink it. So there's a chemical in the leaves called mitragynine that works similarly to opioids like morphine, acting on the same receptor and has effects on mood and perception. And these effects are both stimulant and sedative.
Okay, so there's many differences in how it's consumed in its native country compared to the U.S. We mentioned earlier that in Southeast Asia, they chew the leaves or drink it as a sort of like a tea. But in the U.S., Kratom is derived and consumed most often as capsules, powders, or extracts. The concern is that when we create these products, it takes a large amount of these dried leaves, resulting in a potentially or actually much more potent product.
Yeah, researchers have found that one capsule can contain up to or even more than 3 pounds of dried Kratom leaves. So this can equate to a dose either equivalent to or greater than 91 milligrams of morphine. So based on the effects of Kratom and these extremely potent products, there are significant risks associated with its use.
Right. So a phrase that we use in pharmacy all the time is the dose is the poison. So when people talk about things being toxic or non-toxic, it really depends on the concentration or the potency. 91 milligrams of morphine, for anyone who's never used opioids or even those who have, is an immense amount. And we know that there are products that don't contain as much of that, but just remember that we're making these products available in the U.S. and being used in different ways. So really, there's little scientific data to support its use, even though it's not scheduled federally. The Drug Enforcement Administration said just last April it has no medical use. And Kratom is, of course, it has stimulant and pain-relieving effects. So it's used for depression, anxiety, symptoms of opioid withdrawal. And then at high doses, high potency, users may experience nausea, aggression, hallucinations, seizures, even slowed breathing, like sometimes we see with opioid use. There also have been reported deaths, both from kratom use itself and also with other substances. In Florida, between 2013 and 2023, there were 46 deaths attributed to kratom only. And again, that's a 10-year period, so it's not a lot of deaths, but there still have been deaths. And there were 533 deaths due to kratom combined with other substances, so sort of kratom-involved deaths.
Yeah, what little safety and efficacy data there is, it's being taken from the products used in Southeast Asia and applied to what's being used for the U.S. marketing, even though these products are extremely different, as we mentioned before. So clinical trials are needed to determine the safety and efficacy of the products being sold in the U.S. as per the American Medical Association, or AMA. So all herbal products, vitamins, and over-the-counter medications have standardized labeling that kratom products lack in most states. Like, say if you go into a pharmacy and buy Tylenol or acetaminophen, it clearly says what it's used for on the bottle: fever reducer and pain reliever. Most importantly, it lists the amount of active substance, limits on how much to take per day, and to talk to a healthcare professional before taking this with other medications. In a pharmacy, the medication expert, the pharmacist, is there to answer your questions. Even with a dietary supplement like melatonin, it'll say sleep support or sleep health. We're not seeing uses, instructions, nor active ingredients like that labeled on kratom products. Labeling is so important for consumers to know what they're taking, how to take it safely, and what it's used for.
Yeah, that's great. Even on substances that have psychiatric effects like nicotine or alcohol, you find warning labels on these products that, like with cigarette boxes, they have multiple warning labels like Surgeon General's warning: smoking causes lung cancer, heart disease, emphysema, may complicate pregnancy. Alcohol also has warnings for pregnant people about birth defects, impaired ability to operate a motor vehicle or heavy machinery. Labeling like this helps inform consumers of the risks of using these products. So having labeling like that in kratom products is another way of shifting towards safer use. The only thing approaching a warning on kratom labeling is that it may be habit-forming, which is a first in my knowledge for an over-the-counter product, and recommends pregnant people not to take it. Not a warning, just recommending not to take it. Liz, I know you actually searched for some of these kratom products on the internet. Did the websites have other warnings that aren't required in Rhode Island law?
I did look at a couple vendor sites, and a lot of the time the product said not for long-term use, or sometimes I even saw not intended for use in humans.
So we're supposed to give kratom to our dogs for their anxiety and pain relief?
Very unclear.
Yeah, I mean, probably not a good thing to do either. I mean, I think the important thing is some of the proponents say we want to legalize this. People are using it. There was a news report saying that, you can get kratom if you ask for it in gas stations and things like that. Now, I know it's not available in pharmacies. But remember, if you legalize kratom, which I'm all for legalizing things, I don't want people to be criminalized for taking care of their health. But like kratom, like cannabis, which is legal in Rhode Island and many other places, you're not going to replace black market access. You're not going to replace internet access. It's great that we have a registration system to make it be safe, but when it's legally available, it'll be normalized. And as you saw, not for long-term use. We don't know what acute or even long-term use of kratom is going to do. We know for other medications used for opioid use disorder, for withdrawal, we know what's going to happen, what to expect. Yes, they're prescriptions, they're standardized, all those other things. But I think if people see kratom and they hear about it and they read about it on the internet, and maybe they ordered it on the internet originally, then they're going to buy it in stores and they're going to perhaps keep using it. It's habit forming. And then you can actually become addicted to kratom, which is what you were using so that you didn't use other medications or other things. So I see this extension of now you've got this product. You're going to potentially get products that are now adulterated. We don't know the concentration of the active ingredients. There's lots and lots of problems here. Kratom legalization doesn't create a safe supply of any drug. And I think when people are using things that they don't want people to know about, they aren't talking about it. I mean, Liz, do you think kratom users will talk to their healthcare professionals about their use once it's legal?
Well, making kratom legal will not necessarily mean that they'll tell their healthcare providers about it, and they can also use it with alcohol, nicotine, cannabis, or other prescription meds, and it's important to make sure that your healthcare provider is aware of that. So the active ingredient acts as an opioid drug, so there will be drug interactions with other stimulants and depressants. We already know that there's interactions. There's been research done on it.
Right, and we definitely need more research. So on this stat regimen, breaking news here, what's the regimen for kratom, Liz?
Consult a healthcare professional before using. Make sure you're talking about all other medications and supplements, anything that you're taking. Make sure you know the risks and select products that are produced and distributed safely, not buying from other people or gas stations, anything like that.
Not on the internet.
No.
Okay, well, this concludes our stat episode of the Regimen for Kratom. I think we'll have more to just talk about here. Please let us know what questions you have. Follow us on Instagram and X and LinkedIn at PharmD.Pub Health. That's Pharm as in pharmacist, PharmD as in doctor, Pub Health, and subscribe wherever you listen to podcasts.